Hi, this is Dr. Gottschalk. I am a fellowship-trained pediatric orthopedic surgeon, as well as a fellowship-trained hand surgeon here at Central Texas Pediatric Orthopedics. And today we're going to talk about ganglion cysts. I see a lot of ganglion cysts in this practice. Most of the times it presents with a small bump on the top of the hand. That's probably the most common place. The other two places are usually a small little area on the bottom of the hand, and then also one around the base of the finger on the palm side. Ganglion cysts are not cancers. They are not tumors. They're the most common hand mass that we see, especially in adults, but also now in kids as well. Ganglion cyst is, in essence, a collection of actual fluid that either comes from the joint or comes from part of the tendon sheath. In all reality, it actually becomes more of a gel-like mixture as it stays there. And we think that it comes from, in most cases, overuse, where there's a small little tear in part of a capsule or part of that tendon, and that fluid collects and then causes this bubble. It feels firm when you push on it or palpate it, and it usually will what we call transilluminate. So if you take a cool little flashlight, put it through that area, you'll actually see light come through there, and that lets you know that this is really more of a clear type of liquid or gel, and that's what a ganglion cyst is. It's most commonly seen in young women, especially in the population that we serve, but can still show up in males as well. About half of these don't require any treatment. Usually you notice a little bump, a little cyst, and it maybe sometimes doesn't cause any pain. It's more of a cosmetic thing, but usually these will go away on their own. The other half of them that show up usually will kind of present with some pain, especially when they're doing certain activities, whether that's volleyball, tennis, even on musicians. And some of this repetitive motion we think can aggravate that cyst and force the body to produce more of this fluid that then turns into a gel. There are multiple different ways to treat a ganglion cyst. The most conservative way is usually to wear a small brace, especially when it becomes more symptomatic and causing pain. And if it stops hurting, you can be done with the brace as well. We tend to observe most of these bumps or cysts and try not to do anything more invasive if we don't have to. If it becomes painful, if it starts to affect function as well as motion, then usually you're going to get sent to come and see someone like myself, and we're going to go over our different other options that are a little bit maybe more invasive. If the bump is still causing pain and you're here to see me, the first thing we might do is say, listen, we're going to get an ultrasound to take a look and make sure that it is just this cystic type of structure. Ultrasound is less invasive, it doesn't require any kind of radiation, it's more cost effective, and it's a nice way to know and make sure I can give you the reassurance that you want this is not something bad that we're missing. Rarely will I do an MRI for these, but sometimes if it's in an odd location and I'm still not sure, an MRI may be the next best study to get to make sure that we're dealing with just a cyst. Once we know that this is a ganglion cyst, the next steps are as follows. If it's not bothering your child and it doesn't affect their function, again, we're just going to watch this and observe. If it does start to become more painful and is definitely affecting their ability to do the activities that they want to do, sometimes we'll have your child wear a brace or a splint for those activities. Sometimes we can do what's called an aspiration, and that can either occur with an ultrasound guided aspiration, put a needle into the cyst and try to take that gel-like substance out. Sometimes we can do it in the office as well, depends on you, your child, and the circumstances, of course. With aspiration, the recurrence rate can be as high as 90%. So this is really more a way to temporize for pain, for discomfort, and maybe get your child back to activities while they don't want to do a more extensive procedure like a surgery. If the cyst is still persistent and is still causing dysfunction, then your child may need to have a surgery to take the cyst out. This usually requires a general anesthetic, along with maybe some local as well. It does require a scar to be made, of course. I have to go take this bubble out. And the recurrence rate is anywhere between 20 to 30%. We did a paper back in 2022 looking at these, and we found that we had a recurrence rate of about 27% across 5 national institutions, and that seems about right. Surgery to me is sort of the last option that we need to consider, especially if it's affecting function, if it's causing your child more pain, and if you've been dealing with this for more than several months. The recurrence rate, again, is probably the biggest reason why I try not to jump into surgery. Typically, we'll do some occupational therapy for these kids after surgery to make sure that they don't have a stiff wrist and we can get them back to their activities safely. Ganglion cysts are nothing bad. Sometimes it scares us as parents because it's a bump on our child. And so we'll do what we need to do to make sure that we're not missing something scarier. But at the same time, make sure that we're doing all the reasonable steps. And again, if it's not bothering them and it's not hurting, usually we'll just observe these. If we need to be more invasive with our procedures, we'll walk you through that too.